Hi, this is Dr. Darwin, the new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Coach podcast show, where you guys ask questions and we get the answers to you. Questions, whether you're a pre-dental student, a current dental student, a resident, or a dentist that's been practicing 5 to 8 years or less than that. So you ask those questions, you can send them here at newdentistcoach@gmail.com. Also, be sure to tune in to my YouTube channel, Dr. Darwin Speaks, as I will be posting videos on a weekly basis on Mondays, Wednesdays, Thursdays, Fridays, and even on Saturdays. So I don't want you guys to miss those videos. Today, we're going to be continuing in our series, Careers in Dentistry, but also it's part of surviving residency. And we have a special guest, Dr. Nicholas Gordon, who's a DMD, which is a dentist, but he's also a public health dentist, but he's also a pediatric dentist. So this series is how to become a public health dentist and a pediatric dentist. Dr. Gordon, thanks so much for joining me.
Thank you, Dr. Darwin, for inviting me on this program.
That's great, man. So tell us a little bit about yourself.
Sure. I'm originally from Fort Washington, Maryland. That's in the DMV, so shout out to all the DMV listeners and viewers out there. I went on to Morehouse College in Atlanta, Georgia. And it was really at Morehouse where I realized that not only did I want to become a dentist, but I wanted to become a dentist who focuses on serving those who need treatment the most, those from low income, those from vulnerable populations. And so each summer in between the years of college, I participated in a different summer program. And so the summer programs back then, they were called summer medical dental education programs. And then some individual schools had their own programs. So I participated in a pre-dental program at the University of Michigan, as well as at the University of North Carolina, Chapel Hill, and then finally at Boston University. And, you know, I cannot say enough about how these programs were really important. Even though I already knew I wanted to become a dentist, it showed me some of the other career pathways that I can, take within dentistry. And then in addition to that, we took some coursework in some of the science courses that we would take later in college. And so it really was a really good experience. And it was a particular summer program at the University of Michigan where we had a dentist come and speak to us. And he spoke about how there are oral health disparities that exist in the U.S., how there are populations of people that don't get the care that they need, and that there's something that we can do about it. And so a light bulb went off in my mind, and I realized, that this is the type of dentist that I wanted to be. And so I went on to Tufts University, School of Dental Medicine in Boston, where I received my Doctor of Dental Medicine, as you mentioned, as well as my Master's of Public Health. And then following that, I did 2 residency programs at Boston University, also in Boston. And so, I'll be happy to talk more about that, but it's been quite a journey. It's been fun. It's been challenging, but it's worth it, in my opinion.
So with being an MPH or having an MPH and being a public health dentist, that's also a specialty within dentistry, in addition to your pediatric dentistry residency that you just finished not too long ago, a couple months ago. So do you have to be boarded in both of those? How does that work?
So that's a good question. Yes, so dental public health is one of the recognized specialties of dentistry. And just like pediatric dentistry, just like orthodontics, just like endodontics, oral surgery, dental public health is one of the recognized specialties. And there is a board for both of those specialties to become what people call board certified in dental public health and board certified in pediatric dentistry. Now, it's recommended that you become board certified when you specialize, just because it kind of solidifies that, you are a specialist and, you have completed a specialty training program, and you're pretty much, it's been standardized kind of across the board that, you are now recognized as that specialist.
Right.
But you don't have to do that. And so so a little bit about how I got into both specialties. It was a unique program that both Tufts University School of Dental Medicine had and Boston University School of Dental Medicine had. And so at Tufts, I was able to complete my dental degree as well as my Master's of Public Health simultaneously. And some other schools also have DMD or DDS MPH programs. And then, I knew at that point that, I wanted to, not only have a general understanding about public health and healthcare, which the Master of Public Health kind of gave me, but I also wanted to know, how do we apply this to dentistry? And so that's why I went on and did the dental public health residency at Boston University. And then about halfway through my dental public health residency, the school received a grant to train someone with a public health background to be a pediatric dentist. And so that established this joint degree, this joint specialty program at Boston University, where I was able to do both specialties. So I'm still debating on if I want to be board certified in both of them at this point. It really depends on what you want to do with your career. But I'm pretty certain I want to be board certified in dental public health, and I'm also considering the board certification in pediatric dentistry. So you can definitely do both, it kind of increases your options a little bit.
Got it. So I just learned something. I didn't realize, I know you did your MPH during dental school, but I didn't realize that you did the specialty program in dental public health before you did your specialty program in pedo.
That's right. And I hadn't planned on doing pedo at all.
Right. That's usually how it works too. But, when those grants come and those opportunities come, you make the best of them, because you never know how that may help you or how you're going to help someone later on by having that additional training. So DMD, MPH from dental school. Then you pursued your specialty in dental public health, which concurrently allowed you to exercise a grant or be part of a grant that was looking to train someone with a dental public health background in pediatric dentistry. Wow. And you got both of those from
yeah, that's exactly right.
Got you. So
that's right.
Now that you've got your specialty in dental public health and you also have your specialty in pediatric dentistry, what are your plans? What are you planning on doing, or what's your typical day going to be like?
Mm-hmm. Yeah, so I certainly want to use my clinical skills as a dentist, and so I'm planning to continue to practice. Right now, I'm in a private practice where I see children, but I had mentioned that we are trained in the U.S. to be excellent clinicians, but we're realizing that it takes more, to just be an excellent clinician to really address some of these serious public health issues that we're seeing in various communities here in the U.S. And so, all of this specialty training in dental public health has kind of given me a public health perspective. Even when I see my individual patients, I'm thinking in my mind, okay, yes, they need this treatment, but how can we go from the treatment phase back to a preventive phase? Or I'll see a child who doesn't have any cavities, and I think to myself, okay, how can we start this child off, so that they'll be cavity-free for the rest of their life? And so really, it's not so far-fetched to have both of these specialty trainings, because in dental public health, we're talking about prevention. what better way to prevent dental disease than focusing on the pediatric population, you know, who can grow up to be healthy adults with no cavities, which saves the country a lot of money, saves the child and eventual adult from pain and suffering, you know, from preventable caries, dental caries. And so right now, I am working in private office. I'm also considering a job opportunity with some other organizations that kind of have a more public health approach. And so there are positions available to be state dental director for different states. And that really allows you not only to focus on the individual patient, which I've been doing in private practice, but also focus on a population. And so, you know, when we're focusing on a population of people, then we're thinking of strategies to address dental disease at a population level. And these may include implementing sealant programs in schools. This may include being an advocate for community water fluoridation for your state or community. And so I'm really considering, you know, different options. And then on top of that, I'm also interested, and I have some experience in global outreach. And so I've been working with the National Dental Association in doing global outreach in Haiti, along with Tufts University. And so, you know, really having this, you know, background in public health, it really makes, in my opinion, your dental career a lot more interesting and exciting, because you have all these, you know, opportunities to address oral health at the individual level and at the population level.
Wow, that's amazing. Yeah, I think there probably should be more emphasis on prevention. And some say, well, if it's too much, then, you know, we as dentists won't have a job, won't have a duty and a responsibility to fix people. But again, if you think about the process and how things go down the line, if you can stop it at the early stages, then everyone's more healthy. Everyone has better quality of life. Yeah, it may mean that less dentists are working, but, you know, what's the true purpose of what we're trying to do as oral health practitioners and advocates?
That's right.
You know, so
that's right.
That's amazing, man. I say go for it all. Get boarded on both sides and go that way. Now, as far as a typical day, I know you're working now in private practice, but as a public health dentist and an advocate for oral health, what are some of the things that you think that you're going to have to start doing more as part of your routine as a public health dentist? Because I know you've got the clinical background, got the clinical experience now with the pediatric dentistry, but like you stated, you know, there's a duty and responsibility and heightened awareness that you have now as a public health dentist as well. What are some of the things that you kind of imagine or things that you're going to be doing, whether it be going to conferences, doing different types of advocacy? Like what do you envision yourself doing in the next couple of months or years?
Right. Yeah, so it's very important, you know, not only, you know, someone who's a public health dentist, but even all dentists, we have to stay engaged and we have to know what our states are doing, what the federal government is doing as it relates to dental care, you know, in the U.S. And so right now, many states have provisions within Medicaid to provide dental coverage for children who have Medicaid. But there aren't dental benefits in a lot of cases for adults. And so one challenge that, you know, I have to kind of make sure that I'm on top of is the legislation that, you know, is about to be passed, making sure that I am connected with my state dental association, that I know the issues, and that when there is a call for dentists to maybe go on Capitol Hill or to speak with some state legislatures, that I am on top of that, because I'm a public health dentist. I have training in this. And so I really need to know these issues. I really need to know demographics of, my state, my city, so that when we do talk to legislators, we can, tell them these are the facts. And I think that it's very unique, for someone to have, both of these trainings, because, I can talk about my experience in the office, from what I see, day to day. And then I can talk about, some of the training that I've had in epidemiology and biostatistics, and kind of talk to them, on a level where we're dealing with numbers and statistics, and also some of the strategies that I know work as it relates to, addressing these issues at a more broader level and not just at the individual level.
Gotcha. So
that's really going to be my challenge. Sometimes when you're out of school, that pressure, that pressure of taking classes, and you want to just take a step back and not stay up on things. That pressure is there, but I really have to make sure that I'm aware and that I'm engaged.
Right. So what would you say is a typical salary range for a public health dentist, being such that you could be a state director, you could be on the legislative side, or maybe a congressman or something similar to that? What's the typical range for a public health dentist, would you say?
Yeah, so from what I have seen, I've looked at the application process for, let's say, the state dental director. It really depends on the state. So some states, when it comes to oral health, it usually gets as far as appropriations of funding, it's usually like one of the last things to be appropriated for. So even if a state has a dental director, that's like a big thing, for a state to have a dental director. That's great. And then we're talking about what a salary is going to be. So I would say typically between $80,000 and $100,000 is a typical salary. Now, if you're and I said that depends on the state, so that could range up till 200,000 or more if you are looking at another state. And so that's one part of kind of the puzzle in all this, the salary. But then when you are working for the state, you also get benefits, and so you have usually health insurance coverage, and then when you've worked for the state for a number of years, you can have retirement benefits. And so you may retire after 20 years of working for your state or working for the federal government, and you continue to receive maybe your full check or half your salary, kind of for the rest of your life. And now maybe you can focus on private practice at this time. So it really kind of gives you, you kind of have to look at both sides. Yeah, you may not, like the salary may not be as much as you would make in private practice, but then when you calculate some of the benefits, health insurance benefits, vacation time, things like that, and then retirement plans, then, it kind of adds up and really makes it worth it.
Would you agree as a public health dentist that you're, part of your duty and responsibility, or part of your typical day or typical your routine is attending conferences, maybe even speaking at conferences? I kind of think that as far as the advocacy piece, that a lot of this stuff needs to be heard, and needs to be discussed, needs to be shared. So I kind of envision you as a public health dentist having that part of your routine, or that part of your duty and responsibility as well. Would you agree? Or how do you?
Yeah. Certainly. Okay. Certainly. So, you kind of have to be available. And that doesn't mean, just attending conferences. But if something happens and your state is about to vote, or your county is about to vote on whether or not we're going to continue water fluoridation, you have to be aware of that. And so, there are public health dentists that I've spoken to who have told me, they'll get a phone call, the night before saying that this is about to happen tomorrow and we need you there tomorrow. And so there's sneaky things, as we all know, that tend to happen, when it comes to laws being passed or regulations and things being passed. And sometimes, different interest groups, have maybe a congressman's ear, and stuff is being done quietly, and then bam, tomorrow it's going to be voted on, and people are blindsided. And so definitely, you have to be kind of ready for that. And not just me, but even as a dentist in general, because, for me to go to these events, that means one thing, but then when I can call Dr. Hayes, when I can call, my colleague, in Georgia or South Carolina and say, hey, we need you to write your congressman, it's really about, like you said, advocating, being available, being ready, but also mobilizing, because we're much stronger in numbers. And, when we look at these health disparities, I mean, it really is kind of gut-wrenching that still in the 21st century, Black, Brown, Latino, low-income populations, rural populations are really suffering when it comes to oral health. And I mean, it's really sad. And so, that's the part that motivates me to really want to kind of be available and and kind of, challenge things when stuff is about to happen that's going to affect, those populations.
I got you. Well, this has been so very helpful and informative. What advice would you give any pre-dental, current dental students, or maybe residents who are doing a GPR or doing a general practice residency, and they're looking for a specialty or looking maybe into options and career paths within dentistry? What advice would you give them?
Mm-hmm. So pre-dental students, I would say take advantage of these summer programs. At this point, your goal is to get into dental school. And when you can do a summer program at a dental school that you would like to go to, I mean, that is perfect, because not only are you going to get, you're going to learn what it takes to get into dental school, but you can also form relationships with some of the administrators at these schools.
Yeah.
For dental students, I would say really take advantage of the rotations that you have. So it's fine to not really know what type of dentist you want to be. It's fine to be a general dentist, because we need general dentists. But really, when you do your oral surgery rotation, think, is this something that I can see myself doing? When you do your pediatric dentistry rotation, think about that. And also don't get discouraged, because I remember when I was in dental school and we had the pediatric rotation, I told myself I do not want to do that, but you evolve. You may do a GPR, then you're kind of outside of the dental school setting in a way, or you may do an AEGD, and you're now practicing kind of in like a private practice or public practice setting in the real world, and you can really hone your skills and see, what you can envision yourself doing. And so I would just say definitely take advantage of those opportunities, and then also talk to people. So be involved in organized dentistry, the ADA, the NDA, the Hispanic Dental Association, Society of American Dentists. You want to be a part of these groups, to hear, what other dentists are doing, because like what happened to me, a light bulb may kind of pop off in your mind, and you say, this is something that I want to do. And then just lastly, a bit of advice. I would encourage us all to remember our obligation as health professionals. Mm-hmm. So we have this this privilege, really, to be dentists and to treat disease and really connect with our patients. And it's our patients that are allowing us, this privilege, really. And so not only are we dentists for those patients who can afford care, who can pay out of pocket, who have quote unquote great insurance, we're their dentists, but we're also dentists for those who may not be able to afford care. And so I always encourage people to, make sure that you remember, your obligation to serve all people, not just certain segments of the population. And you can set up your practice. You can do, how you would like to set things up. You can, organize it whichever way you want to do it. But a segment of your populations of patients that you treat, make sure that you're, treating those who maybe have Medicaid insurance or really can't even afford care, because it does make a big difference.
Right.
And so that's some of the advice that I would give.
And I like that, man, because that advice, the last piece, as far as us refocusing on our duty and our responsibility as healthcare providers, leads us also to solve the problem of this access to care problem, which we have to advocate to legislators and create opportunities where, if you want dentists to go back to the rural areas, if you want dentists to go to the cities where they're not big populations of people to provide dental care, you have to, there should be an obligation for the state and the government to also provide opportunities or provide legislation that allow us to be able to serve people in those areas. One idea has always been, let's do some more loan repayment programs that allow dentists for 3, 4, or 5 years to go out into the areas and really put a dent in the access to care problems. But it has to be a win-win. It has to be a win-win. And I think that's still the challenge now, especially with a lot of the new dentists that are coming out now with an average of $287,000 worth of loans. Most of them are not looking to go into the rural areas and not make a lot of money because they got these loans sitting on their heads and their necks, and they're concerned about that. So you're right. Mm-hmm. Having that knowledge about public health and advocacy is important as it relates to solving problems, but also integrating and working with other, collaborating with other people so that we can make the situation a win-win for everybody. So this has been very helpful, Doc. I'm so proud of you. I learned something more than I had already known about you. I found out some new things. So this is great. I definitely want to get you connected. We have a program at the residency program where we are developing residents to be oral health leaders, and we're going through a year program where we do that. And I think you'll be a great speaker and moderator to address some of these issues that we keep hearing about. But now as residents, it's a little bit closer to them being part of the solution versus just hearing about it in school and just being more concerned about the technical side. So I'm going to keep your name on the top of my Rolodex for coming to speak to residents about these issues and the things that we're talking about. How can people get in contact with you if they have questions and want to just connect with you? What's the best way?
Sure. So the best way would be my email. So my email address is my first and last name. So Nicholas, Nicholas .Gordon, Gordon, DMD @gmail.com.
Great.
And then I'm also on Twitter at NBGordon. That's my Twitter handle. And then you can find me on LinkedIn as well. Just kind of put in my name. What is it?
You said what's your Twitter again? Twitter?
The handle is at NGGordon, okay. DMD.
Okay, gotcha. And you're on LinkedIn as well. I think that's one of the ways that we connected as well. Hey, Dr. Gordon, thank you so much for your time. Your wealth of knowledge as a public health dentist and also as a pediatric dentist is just amazing. So proud of you in completing and surviving yet another residency, which is pediatric dentistry, which you really hadn't planned on doing, but kind of fell in your lap because you were in the right place at the right time and had some good networking, and it had a good purpose and vision as to what you wanted to get done in this career of dentistry. So thank you so much for your time, and I appreciate you.
Thank you, Dr. Darwin. I appreciate you using this platform, to bring this information to residents, students, and everyone who's listening. So, yep, I appreciate you, brother.
Hey, thanks so much. And if you guys out there appreciate what you hear, you found that this information was very valuable, send us a comment down below. Also, if you have questions about other information or topics that you want to hear about, shoot me an email right here at newdentistcoach@gmail.com, newdentistcoach@gmail.com. Remember, you ask the questions and we get the answers for you. Okay, that's it for today for how to become a public health dentist and pediatric dentist with Dr. Nicholas Gordon. Thanks, Doc, and we'll talk to you soon.
Thank you.
All right, take care.